Delhi is reporting a significant rise in the number of COVID cases and COVID fatalities. Just in the last 12 days, the national capital has reported over 2,000 cases for 12 days consecutive. The deaths also have been at an all-time high in the last 6 months. To understand this in a bit more detail, I'm joined by Dr Suneela Garg. She is a member of the Lancet Commission and also a public health expert. Doctor, thank you very much for speaking with us.
Thank you.
Delhi is reporting a significant rise in the number of cases, just 2,000 cases for the last 12 days consecutive. It has sharply dropped also, it's 1,200 yesterday. The number of COVID deaths as well have risen and are fluctuating. As an expert, what are your comments on this?
Sonakshi, again, I'll say from a public health perspective, it is a very important question because we need to constantly keep a watch on COVID situation across the country, and particularly we do have now surveillance system and we do have a dashboard which tells us about everyday situation also. So when we are looking at Delhi situation, we have seen that constantly, if particularly I was to talk of last 3 days particularly, and you mentioned about yesterday, we are constantly getting cases about 2,000 and all that, though our recovery rate is also good. But important part is that earlier we never saw many cases who were hospitalized in between. So if I was to look at the scenario of today and yesterday, Delhi has got almost about 9,416 beds, out of which 588 beds are occupied, right? And then we have got oxygen beds 8,845, out of which 560 beds are occupied. Then we have ICU beds also 2,129, and we have got 205 beds occupied. So that shows kind of situation about which we need to be cautious. I will not say that it's for everybody to be panicking around. We need to be cautious about the situation and keeping the whole thing into consideration. And you mentioned there are deaths also. I'd like to add to that also that there are 65 people who are on ventilation as well.
So these numbers, I'm sure this is, like you mentioned, it's no reason to panic, but are these numbers a significant rise in the last 6 months that we have seen? Because we did see a dip in the number of cases. It was way below 100 and there were no deaths being reported, and now we are seeing 10 deaths that have been reported. We are seeing, like you said, hospitalization. So can we say that the hospitalization has increased?
You see, definitely when the beds are occupied, there is an increase in hospitalization. But if I was to say out of 9,416, 588 beds, it may not be a large number, but it is a marker towards being cautious. That is where it is. So that's where Delhi Disaster Management Act meeting took place and masks were revoked, so that people must not only be complacent to the masks. Also, we need to focus upon, the vaccination part also. If you'll remember that, people have taken precaution, 2 doses a long time back, and by the time, the time came to take the boosters and the boosters were made available, they thought that now we are not seeing much number of cases, not seeing much deaths.
People have become complacent and they think they've become lazy towards taking a booster because they think they've taken 2 rounds of the dose and they don't need another round. This is some of the common reactions I have also seen on the field, that people don't want to take the booster because they think COVID is over. That's not right.
Absolutely. That's how under Eco India platform I conducted, I think, 6 rounds of training which was addressing all towards vaccine hesitancy, because COVID has not gone out of our lives. We have to remember that, and we also have to see that which virus has taught us that it's not that vaccine which you take in you take 2 doses of that vaccine, because the vaccine is on different platforms, so for which we are requiring 2 doses at different varying intervals. So it's not like that we take 2 doses and we finish with it and we are done away with it. The science has taught it, and then constant observation has taught that immunity wanes over a period of time. Though people who are vaccinated with 2 doses, basically in them again the infection and all is to the lesser extent as compared to people who are not vaccinated. But then when that was the time we were talking in 2021, but now in 2022 when we are in 75th year and all that, we have got sufficient doses which are available. And Government of India has also announced, free doses for people who are precautionary doses for people who are above 18 years of age. They can come forward and take that, because it's high time now. More than 9 months have passed, and we have reduced the gap also from 9 months to 6 months for the precautionary dose. So they should come forward and they should take the vaccine. So that's another reason when immunity goes down and people are complacent. So, and also they're elderly, they're comorbids also. So that's where you are, kind of compromised on all fronts. That means, first of all, your immunity has gone down. Secondly, you may be comorbid, you may be elderly. So things may not be in your favor.
Right. So does Delhi need to buckle up?
Delhi has already responded in that direction, I'll say. But, now we need to be very vigilant about the number of cases which already, kind of thing which has happened. It has responded, I'll say, in a very fast manner by bringing the mask culture into, or wearing of masks as mandatory thing. And second thing is, we should not forget, by the time, Raksha Bandhan starts and all that, the festival season actually starts. So, that's another thing. Wherever, you go, there's going to be overcrowding and all that.
Right.
So we need to be, kind of appropriately following COVID appropriate behavior. That means wherever possible, the distancing part. And we should never forget that with great difficulty we brought in the culture of hand washing or sanitization. So I say that all these three should be complemented, and at no point we should be complacent.
My final question, and a very common question that is now emerging amongst people as well, people who have taken 2 rounds of vaccination, dose 1 and dose 2, and some of them who've also taken the booster shot, they still are getting COVID. Now, vaccine does not mean that you don't get COVID, of course, we know that, but the common question is that if somebody who's getting the second round of COVID, is he bound to get it for the third time or the fourth time? Is it common?
See, definitely. You are perfectly right in asking me this question, because as I said that we are getting mutant strains of virus. Original Wuhan strain, after that we got alpha, beta, then we had a very severe delta driven wave. If I was to tell you the numbers, I'd say that BA.2, this genomic sequencing was available with us on 1st of August, accounted for 40% of our cases. Now another thing is BA.2.12, accounted for 19%, this genomic sequencing, and BA.2.75 accounted for about 38% of the cases. So that, and these are all Omicron variants, right?
These are all Omicron
variants. So you see, that means, when we have been vaccinated, so we have seen 3 strains right now, and each one is, they are Omicron, they are, we can say they are kind of, of the same origin. But then, for each one, they transmissibility is different. Also as of now we see much less severe number of cases as we saw during Delta wave, because you see now all of us have got some immunity by getting ourselves vaccinated against 2 doses. Majority of our population, almost I'll say that 97-98% people are nearly vaccinated with 1 dose, and almost 80% plus are vaccinated with 2 doses, right? But then immunity wanes over a period of time. That is what virus has taught us. So we need to take boosters. But this is, as of now, the Government of India's policy is to take, at least 1 precautionary dose should be taken by everyone above 18 years of age, and more so for people who are elderly with comorbidities, even younger people who are on dialysis and all that, they should take this booster dose. And because the vaccines are available now, and people who have not even taken 2 doses from 12 years onwards, they should complete their 2 doses of the vaccine, right? Primary doses only have not been completed
Delhi with festival season kicking in, Delhi has to be vigilant and Delhi has to buckle up, given that we are seeing a significant rise of cases and COVID deaths. But as an expert, you have said there's nothing to panic about as of now, but certainly a marker for caution.
I'll say that it's not only Delhi, it's the country as a whole. We are talking of one planet, one health. or we talk of global health security, because our borders are so porous. So across the country we need to be vigilant about that. And you see every day, if somebody is staying in Uttar Pradesh goes to Delhi or in Haryana, because borders are so porous. So everyone needs to be very vigilant and governments need to be very responsive.
Right. Thank you very much, Doctor, for speaking with us. Dr. Suneela Garg speaking to us on the importance of being vigilant, especially with festival season kicking in and cases rising, including COVID deaths and, most importantly, hospitalizations also seeing a rise. In Delhi with Pooja Arya, Shanakshi Chakravarti for NDTV.